Hi, I'm Dr. Terry Schraeder. Where do you go when you're sick? Can you call your own doctor? Should you go to the emergency room, an urgent care clinic, or a retail clinic in a drugstore? Does it matter? It does matter, and let me tell you why. If you're having a true emergency, such as any of these symptoms, chest pain, shortness of breath, bleeding, or signs of a stroke, then you need to call 911 and be seen immediately in the ER. Emergency room doctors can save your life. But what if you're having mild symptoms and it's not an emergency, such as a cough, sore throat, a mild skin infection, or even a chronic problem you've had for years? For these symptoms, first try to call your own doctor. But what if you don't have a primary care doctor, or it's the weekend, or you're traveling out of state? Let's look at the differences between a retail clinic, an urgent care clinic, and the emergency room. Retail clinics are staffed by nurses and open during the day and after hours. They're in drugstores and supermarkets, and they treat common mild ailments such as sore throats and insect bites. They offer flu shots and other vaccinations. The average cost is $55 to $75. If you have insurance and the clinic accepts it, you may still have to pay a fixed copayment at the time of the visit. Urgent care clinics are generally staffed by physicians. They're also open daytime and after hours. They can be inside a hospital or freestanding. Urgent care clinics are not equipped to treat life-threatening emergencies. They do treat mild infections, bronchitis, minor bone or joint injuries, and minor cuts and burns. They offer x-rays and lab tests, and the cost, on average, is $120. If they accept your insurance, you still will likely have a copayment. Emergency rooms are staffed by ER-trained physicians. They're open 24 hours a day, and they treat life-threatening problems such as chest pain and major trauma. If you don't have an emergency, you may have a longer wait. The average cost is over $1,000. If you have insurance, you still will have a copayment. It may be higher than any other type of visit. If you know where to go when you're not feeling well, you'll save time, money, and get the appropriate care you need. You don't need to go to the emergency room for a flu shot or the sniffles, but you don't want to go to a retail clinic with chest pain. The best advice is to make sure you have a primary care doctor and talk to your doctor first before you get sick about all of these issues. From Harvard Health Publications, I'm Dr. Terry Schraeder.